Good afternoon. This is Dr. Do again. This video is alphabetic list problem on letter E. I'm going to talk about epigastric pain. I think if you follow my stream, I have another video on abdominal pain, include some of the epigastric pain. But today I'm going to talk in a different aspect of the epigastric pain. First of all, regarding to the pain, what kind of pain, indicating you may try some regimen at home, or what kind of pain you need to see the emergency, or what kind of pain, how to describe the pain, how to recognize the pain associated with the either serious problem or problem can be minor, or in terms of the quality of the pain, either sharp or dull, or the tempo quality of either constant or intermittent. So I'm going to emphasize this kind of information to help you to identify whether this pain, epigastric pain, warrant an emergency visit, or this epigastric pain can manage at home. And regardless of what, the abdominal pain usually do not recommend taking any pain medication. Regardless, it's a dull pain or it's a sharp pain, it's acute, it's chronic. Usually, especially for the surgeons, they really do not recommend pain medication for the abdominal pain, unless it is not abdominal pain. You feel like it's abdominal pain, but it's not. Otherwise, if the internal organ of abdominal pain, usually is not recommended for taking pain medication at home. So anyway, regarding to this epigastric pain, is any situation, what kind of signs you're looking for to visit the emergency? There are some, like for example, the pain is kind of suddenly burst, sharp pain associated with vomiting blood. That is one. And also the pain, nature of the pain is spasm associated with fever, nausea, vomiting, especially the skin is kind of yellow, and for those who vomited probably the bile, or for those who really knowing at the risk of the gallstone. So this is the two of them. Or the abdominal pain is associated with older people with history of hypertension, and the pain feel like restless, diaphoresis, and feel regardless what you do, just the abdominal pain, not comfortable, associated with nausea, vomiting. Not necessarily has to be sharp, it's just the aching sensation and the restless. Diaphoresis with sweating and restless, especially if the pain radiating to the left arm. For those with the past medical history of hypertension, diabetes, probably that indicating something really serious. So these are the signs. You really need to go to the emergency. So what kind of pain you can try some regimen at home. Like I said, the pain is kind of aching. It's not sharp, not spasm. It's just aching pain, and especially you have just taken some leftover food associated with nausea. So if that's the case, then you can monitor at home, just rest and rehydrate, see whether it can get better. But however, if the pain still there, does not improve, then you need to see your physician, call your physician, or see the emergency room if the pain getting worse. So these are the category I broke down. And in terms of the pain, what kind of the quality of the pain, like I mentioned, could be sharp pain. What kind of problem can cause the sharp abdominal pain? Perforation, for example, for those with past medical history of duodenal ulcer or gastric ulcer. So suddenly the sharp abdominal pain, epigastric pain, that probably indicating you have something worse or bad going on, especially if you press the epigastric area, feel guarding, very stiff. That's probably means it's serious. What kind of other pain that are you really indicating serious problem? like the spasm pain associated with jaundice, with or without jaundice, and the fever, and diaphoresis. This probably indicating either gallbladder or, like I said, restless, regardless what you do, just not feeling well, and especially for those with past medical history. So this kind of sharp pain, spasm pain, or in terms of the tempo, nature of the tempo, whether it's constant or intermediate, or constant with intermediate aggregation, means getting worse with time. But the pain is there, but suddenly you feel worse and then getting better. So this indicating probably is similar as the spasm. So that probably is the cause. So anyway, what are the causes for the epigastric pain? Let's review before we do that, just briefly tell what the organs in that are epigastric area. First of all, stomach, duodenum, and the colons on the left and right side, fracture, but it's usually on the back, so it's not quite associated with epigastric pain. And of course, the gallbladder or liver can cause this pain, feel like epigastric, even though we know the gallbladder is in the right upper quadrant, but sometimes can have this epigastric pain. So these are the important organs that are associated with epigastric pain. What kind of diseases associated in these organs associated with epigastric pain? Serious disease like ulcer, gastritis, or the reflux even can have the sensation of epigastric pain, or like I said, the gastritis caused by the fresh bacterial infection, usually associated with nausea, vomiting, and so even though the pain is aching, you do not have fever, but you just have constant nausea, vomiting for a couple of days, nothing can hold down. So if that's the case, it could impose the risk of electrolyte imbalance. So if that's the case, you need to talk to your physicians or see whether there's some way to hold the fluid, or give some medication to hold the fluid, but under the guidance from your physician. So this is the epigastric pain. It's quite straightforward, and what kind of condition of in between? It's not emergency. It's not manageable at home. You have to see your physician. Gastritis is the one. Gastric or peptic ulcer is the other one. Or the H. pylori. It's probably the symptoms just aching pain associated with the regurgitation, or the GERD, gastroesophageal reflux. It's also associated with this kind of condition. Seems not that serious, but bothers you all the time. So you tried some over-counter medication, but still not feeling better, and call your physician to be managed under the physician medical advice or supervision. Surely will make you feel better. So this is another video, probably similar to the previous one, but I just it's kind of to remind you in terms of epigastric pain, what kind of information you need to know, either the quality of the pain, the time, nature of the tempo, either constant or intermittent or sharp, dull, or aching, or spasm. So this kind of pain indicating different problem cause the different sensation of the pain. So regardless, take home message. If you manage at home, even though the problem is not serious, you manage at home for a couple of days, not getting better, see your physician, call them. Probably just one phone call or just visit briefly can solve the problem. Or for those emergency situations, do not hesitate, visit the emergency room. And also be ready with this kind of problems, and in terms of the severity of the pain, quality of the pain, in terms of time, what kind of and also what kind of situation make the pain getting better or worse. So anyway, so this is just regardless of epigastric pain or any other kind of pain, usually evolve in this kind of questions. You need to know. Probably it's better save time to communicate with your medical care providers. So anyway, I'm going to stop here. This is a last minute decision to talk about epigastric pain. Since I had it before, but I just figured just put it here just in case for those who did not have a chance to watch previous one, and also with different emphasis emphasis. So anyway, thank you for watching. I will see you next time.